Medical professionals of Reddit, you are capable of stockpiling 6 different medications for the post-apocalyptic world. What medications do you stock, and why? Levofloxacin, cefepime, fentanyl sublingual, active carbon, epinephrine, pyridostigmine. Levofloxacin and cefepime are broad-spectrum antibiotics with different coverages. Fentanyl as effective painkiller. Active carbons can help with cases of mild to moderate food poisoning, and a lot of poisoning from ingesting substances. Epinephrine for moderate to severe allergy reaction and for CPR cases. Pyridostigmine because of my illness and my lifeline depends on it. Along the lines of you choosing pyridostigmine, I would choose insulin. As much as I don't need to, I know people who do and would prefer to help them. Even if I didn't, I would meet someone who did, and even if I didn't like them, it would make a great currency. Oh crap, I spend way too much time thinking about this crap. I'm a doc who's done some work abroad at really underserved countries. First off, no ACLS dose TP. This is different than my first choice, adenosine, or amiodarone, etc. If I'm using ACLS drugs in a post-apocalyptic setting, you are already dead. And I'm guessing most OTC drugs will be easy enough to scavenge. Either way, I can live without them. What's going to kill you in the majority of post-op settings that I can prevent from killing you are infectious diseases. 1. EpiPens. I can probably find Benadryl somewhere, but the treatment for anaphylaxis is epinephrine. There's a reasonably good chance that if I can get you through anaphylaxis, you'll make a full recovery, so long as the offending agent isn't something essential like MREs or something. 2. Moxifloxacin. This is one of the broadest spectrum antibiotics. It's gonna cover pretty much everything except MRSA and Pseudomonas. 3. Clindamycin. Here's the MRSA and other gram-positive organism coverage. 4. Albuterol. I feel like this one is pretty self-explanatory. 5. Lorazepam. Any benzo here will do. Anticonvulsant. Sedation. Overall a pretty useful med. I can give lorazepam sublingually at least. 6. Albendazole. Everyone forget about intestinal parasites are a thing until they get intestinal parasites. 7. Fluconazole. Everyone forget about fungal infections until the world ends. 8. Doxycycline covers atypicals, some E. coli, and MRSA. The reason I choose it is that it will treat your tick-borne diseases, Lyme, Rocky Mountain spotted fever, etc. 9. Opioid of your choice. I'll probably stick to something classic like morphine or hieromorphone. 10. LR. Bags and bags of it. Dehydration will kill you faster than anything. Fluids fix dehydration. I'd just like to thank everybody choosing antibiotics that aren't penicillin. It would suck to survive the apocalypse and go down from an allergic reaction. Penicillin is not the antibiotic of choice when it comes down to an apocalyptic situation. Gotta have stronger, broader spectrum antibiotics. DW. You'll be fine. Source. I am an emergency medicine resident physician. I would go with meds with multiple uses if possible. 1. Ketamine. Surgery intubation level sedative at high doses. Knockdown psych med at medium doses. And excellent analgesic at low doses. 2. Diphenhydramine. Benadryl. Sedative, antihistamine, and can be used as a local anesthetic if injected. Edit. Also works as an anti-nausea medication due to anticholinergic properties. 3. Doxycycline. Good broad-spectrum antibiotic. 4. Lactated ringer solution. Go to have that hydration. 5. Iodine. Used to purify water and disinfect skin to prevent post-operative infections like the ones that killed everyone in the Civil War. 6. Whole blood. It may be cheating to call blood a medication, but if there is bad trauma, give me enough whole blood and I can keep you alive for long enough to make the bleeding thing stop bleeding in about 75% of cases. A lot of the drugs listed by others don't apply in a post-apocalyptic world. Epinephrine barely works in cardiac arrest anyway, so while let it take a precious spot, and true anaphylactic shock is pretty rare, within a generation of post-apocalyptic mega immune assault, fatal allergies will become even rarer. Tylenol? Shake it off. You're coming to me because you are dying. Deal with your headache somewhere else. Surprised to go this far down the list to see iodine. Old school. Plus purifying water would see off so many potential illnesses and infections. I'm seeing very few antifungals and antihelminthics. I'm guessing fungal infections and parasites would become much more common in a post-apocalyptic world. Also, I don't know if oral rehydration salts and iodine sterilization solution count as drugs for this question, but in terms of number of lives saved they're pretty heavy hitters. Fungal would be more common but also more severe. Usually by the time your immune system breaks down enough to stop fighting fungus it usually advances pretty quick. In the apocalyptic world you're going down by that point anyway. Morphine, epinephrine, a broad spectrum antibiotic. I hate myself for that one. Ketamine, diazepam and doxycycline. You'll all come crawling back for my antiprotozoans before the end. If you're one of the people who opted to bring a multivitamin then I'm not giving you any. Immunologist. Ciprofloxacin, vancomycin, fentanyl, atropine, epinephrine, novocaine. Strong antibiotics, obvious use. Fentanyl and novocaine. High power painkillers that would potentially allow basic surgery. EP for potential anaphylaxis. Atropine for cardioversion in case of cardiac arrest. Edit. I was thinking of adenosine, not atropine. I'd probably also add streptokinase, just in case of a clot, either heart attack or stroke. No one is adding any form of birth control. That pregnancy crap is going to kill you or slow you down. Abstinence? Even if I don't choose to have sex. I am living in a post-apocalyptic world with no justice system, so rape is going to be a serious problem. For women to survive ages 13-45, we are going to need birth control. How you can tell most Reddit users are dudes, some birth control and men or women I know, basically hemorrhage uncontrollably for weeks at a time and can't leave the fetal position due to intense pain. To say nothing of the imperative that most of us would absolutely under no fricking circumstances want to end up pregnant in this scenario. Probably some Stimpaks, Radaway, Mentats, Buff Out, Med-X, and Jet. The wasteland is a dangerous place, but keep these around and you'll be just fine. Jet was invented after the apocalypse yo. Nobody seems to be listing simple topical antiseptics. While it can be handy to have a broad spectrum antibiotic on hand, it might be better to be able to effectively clean and disinfect a wound, so you don't get that gangrene. I remember in Stephen King's The Stand, where some people are traveling by bicycle. One has a fall and scrapes their hand. Their partner stops and sprays the wound with Bactine and thoroughly cleans it. That struck me as a really good habit to cultivate, along with generally good hygiene, an ounce of prevention. Pharmacist here. Alprazolam, Xanax, 2 mg bars. When the world goes to crap, you bet anxiety will be through the roof. Also to aid in sleeping. Also for possible trades for food or other supplies. Doxycycline 100 tablets. I guess it's regional but apocalypse means living outside. Ticks are outside. Doxy has a good spectrum. Only issue is sun sensitivity but I'm brown so I'll be okay. Oxycodone 30. Can split to lower dose if needed but strong enough to get you through a decent amount of pain. Also good for trading if needed. Amphetamine salts 30 mg. Adderall. Need to be wired for dealing with all the apocalypse bulls. Running from caravans of crazies to just building shelter. It's also an appetite suppressant when food is scarce. Also trading capabilities. Can be cut to lower dose as well. Hydrocortisone cream 2.5%. Mosquitoes. Somehow no one ever is itchy in these apocalypse shows. I went outside once at night 2 weeks ago and I had bug bites for over a week that drove me crazy. Daily outside activities equals a lot of bug bites. Fluconazole 150. Frick yeast infections. Also another post-apocalypse issue never brought up. Vaginas suck. They get all sorts of fricked up now. When the world ends it's only downhill. Also it's an antifungal and guys can use too. After about 2 weeks of near constant mosquito bites, you tend towards not noticing anymore. Source: am not medical person. I'm former Minnesota camp counselor who never brought bug spray. Oxycodone for pain. Ketamine for surgery. Xanax for antidepressant anxiety. There will be a lot of anxious people in the apocalypse. C to come up from the Xanax and for staying up for long periods of time in dire situations. Marijuana is a blanket catch-all for everything else. Party City. C is not gonna be strong enough for that. I'd recommend a healthy dose of methamphetamine. With enough of it you'll never need sleep. Off the top of my head, lactate ringers solution, cefepime, albendazole, naproxen or ketorolac, some prednisolone, IV form, bupivacaine. LR is an important fluid for treating sick, dehydrated or hypovolemic people. Life-saving supportive care. You'll definitely need this when you pick up some nasty diarrhea from that untreated water you're drinking. Cefepime is a broad-spectrum antibiotic. Albendazole is an antiparasitic that'll knock out most worms. Trust me, you'll get worms in a post-plumbing world. Probably more important to stay dewormed than to have a multivitamin. NSAID for pain and anti-inflammatory. Steroid for pain, anti-inflammatory, and adjunct therapy to loads of conditions. This is a life-saving drug in asthma attacks or allergic reactions. I could be convinced to give this up for another antibiotic though. Bupivacaine is a local anesthetic. It can be used for epidurals and nerve blocks in case of the need to do abdominal surgery or something on a limb. This is probably the bottom of the list. Maybe you'd take an opioid like fentanyl that doesn't suppress CV function a whole lot instead. Not ketorolac. Can't use over 5 days and it kills kidneys. I'll repost my reply from our pharmacy. First thing is first, empty all the meds you take into a bag and throw out the bottles. That way, they, fellow survivors, need to keep you alive to know which pills do what. You want broad spectrum antibiotics. All of the opiates, addicts will trade, and all of the benzodiazepines. To keep people from shrieking at night, you should probably grab the inhalers and some anti-inflammatories. You're gonna be running a lot. Tetanus, polio, hepatitis A and B vaccines and MMR. Might as well survive all this stuff before I have to worry about the rest. Oh yeah, I'll need some Tums. I would try to stick to oral or topical meds TBH. The logistics of finding needles, syringes and sterile IV equipment is in my opinion too much. 1. Doxycycline. 2. Bactrim DS trimethoprim sulfamethoxazole. 3. Linezolid. 4. Fluconazole. 5. Iodine. 6. Oxycodone. These first world doctors don't understand what a badly fallen society would look like. 1. Anyone needing a rescue inhaler bad enough is dead already. 2. Anyone with severe allergies is dead already. 3. Anyone with a blood clot, heart attack, stroke, etc. is dead. 4. Anyone who requires intravenous fluids and meds is, guess what? Freaking dead. 5. Diabetic? Need insulin? Guess what happens to you? Rhymes with well fed. The correct answer is antibiotics and bullets. Preferably leaning towards the later. 2. Anyone with severe allergies is dead already. I don't think so. It depends on the kind of allergies. Peanuts, bee stings, dairy and many other things can be avoided, even in an apocalyptic situation. Even if you have severe allergic asthma and mold spores or certain kinds of pollen can kill you, it's not hopeless. You can avoid all that crap if you leave the areas where those things occur. Fentanyl, Cipro, Levaquin, saline, Ativan, vancomycin. Stop the hurting, kill the infection, pump you back up with fluids, chill you the frick out, and after a few days rest you'll be set to go again. Antibiotics, Zosyn and vancomycin. You can kill almost any bacteria with these. The drawback to these two are they can only be given IV. I thought about Levaquin instead of Zosyn, but then you miss some common bacteria. And yes, I know Zosyn is cheating because it's 2-in-1 and this combo will ruin kidneys. Sedation, analgesia, ketamine and fentanyl. Ketamine works well for anesthesia and can be used for pain. Fentanyl is excellent for pain and can be administered IV or intranasal. You could convince to drop fentanyl and just use ketamine for all pain, but I don't have a ton of experience with it. Steroid, hydrocortisone. It can be given via many different routes, IV, transdermal, oral, and will help many people with inflammatory diseases, asthma, Crohn's, anaphylaxis, etc. Benzodiazepine, Ativan. So many uses and can be given IV. PO, rectal, helps with seizures, anxiety, alcohol withdrawal, sedation. Bonus, insulin, aspirin. Ketamine and fentanyl were both given to my 7-year-old daughter, along with a dose of morphine. after she broke her radius and ulnar a few months ago. The part of the country we live in, I'm not used to hearing about fentanyl or ketamine in a therapeutic setting, but they were the go-tos in a pediatric hospital, so I'd run testosterone, bol, and Deca and become a freaking monster. I'll throw in some cardarine to offset side effects and become a cardiovascular machine. Stronger, faster, leaner. I'd be a post-apocalyptic god. To left, I'd add clomid and mitotane like timber to the fire, keeping cortisol and estrogen from extinguishing my resolve. While you kids are having fun getting high on painkillers and playing with antibiotics, I'll be busy conquering this forsaken world. Epinephrine, digoxin, ciprofloxacin, lidocaine, aspirin. I'm cheating by getting 2 vaccines, pneumococcal and the combined DTA or Hib and polio. I'm a doctor, and I think this list gives the biggest bang for your buck. For all those people with multiple strong antibiotics, that's a waste. Anyone needing those will die anyway. If Cipro doesn't kill your infection, then you're dead without IQ care. So EP is obviously good. I'm not giving it for CPR, as you're already dead. Asthma, allergies, etc. Lidocaine needed for procedures. Can reduce fractures, dislocations, sutures, and appendicitis. I think aspirin is pain reducer, fever control. MI, if you need stronger pain meds, you're probably gonna die. Maybe the aspirin will save a life with an MI. Lastly and most importantly are vaccines. I could argue that this list should just be vaccines. In a post-apocalyptic world we can't save everyone. We need kids to survive till adults. Vaccines do that, and Cipro. Who cares if they're short with ruptured tendons? They will survive. LSD, fentanyl, THC, MDMA, ketamine and DMT. Fairly easy, especially as stockpiles of super potent chemicals like LSD and fentanyl, or the even more potent analogs, would be easy to store due to their relative potency by weight. I'm allergic to all the antibiotics, so we gotta go without those already. Ketamine can be used, usually with a benzo, for doing basic surgeries and stuff. Can have a great time mentally on LSD or spiritually on DMT. The THC has obvious benefits. In addition, the MDMA is just for the weekends. Nicotine, Valium, Vicodin, marijuana, ecstasy, and alcohol. We could be the queens of the post-apocalyptic Stone Age. Frickin' dude, I am with you. I don't wanna live if all my friends are dead and suddenly I have to worry about worms coming out of my butt. Since this is the apocalypse, we need to focus on drugs that can treat short-term survivable injuries. So maintenance medications are out. Sorry, insulin folks. Sounds cold, but it's every man for themselves now. 1. Cipro. Only because it's mentioned a lot here and we don't study antibiotics until next month. 2. Epinephrine. Treat anaphylaxis. 3. Xanax. Great for acute anxiety, decent for sleep, also can be bartered for other needed drugs. 4. Fentanyl. If you have a pharmacist or have a general knowledge of chemistry, you can compound dilute it to a reasonable dose. Also used to barter or drug people. 5. C. Potent local anesthetic, vasoconstrictor, and stimulant. Also used to barter. 6. Albuterol. Asthma seems to be quite common, especially during allergy seasons. Albuterol and Atrovent for respiratory distress. Fentanyl. Stronger and faster acting synthetic morphine, and I can use it to RSI someone. Put them under and intubate. Saline. Fluid replacement, and it can be used to dilute medications. Epinephrine 1000 can be administered IM for anaphylaxis. You can dilute it with saline to make EP110000, which is given IV for cardiac arrest and can be used for bradycardia, plasma or blood. It's hard, but I'm leaving D50 behind. Prednisone. Versatile anti-inflammatory for chronic conditions, COPD, Crohn's disease, and acute conditions, poison ivy, gout flare. Ciprofloxacin. Antibiotic that covers a variety of infections in the abdomen, bone or soft tissue. Morphine. Pain medication useful for acute injuries and end-of-life care. Epinephrine. Sympathomimetic useful for allergic reactions, vasoconstriction for wound closure, or as a vasopressor in critically ill patients. Bartering, antibiotic useful for soft tissue infections and UT. Good to have more than one antibiotic because of patient allergy or bacterial resistance. Folic acid, not a medicine but a vitamin that is very important for preventing neural tube defects in neonates. This would be critical for all childbearing women, and I imagine we would need to repopulate after an apocalypse. Great question with lots of reasonable choices. Meropenem, moxifloxacin, fentanyl, ketamine, prednisone and fluoxetine. Meropenem and moxifloxacin to cover most infections. Fentanyl for pain. Ketamine for anesthesia, safer than propofol considering the lack of monitoring equipment. Prednisone as an anti-inflammatory. Fluoxetine because I figure lots of people will be depressed in a post-apocalyptic world. Fluoxetine. I'd pick diazepam instead since SSRIs aren't exactly effective for everyone, and then you get the added effect of being able to deal with some types of seizures. Prednisone, albuterol, vancomycin, Lasix, acetaminophen, itraconazole. How don't more people not have Tylenol on their lists? Go to break a fever somehow and it does double duty for your aches and pains. Also, no one has any respiratory drugs but me? Come on man guys, do you even wanna survive the end of the world? Diabetic, so ad hoc medical knowledge person in my social circle. Long-acting insulin. Diabetics will die without it. Antihistamine epinephrine. Allergies. Broad-spectrum antibiotic. Will help flesh wounds. A benzo for panic situations. An antidiarrheal med. Some sort of electrolyte powder. Methamphetamine antihistamine for those bad runny noses. Also, gonna need a lot of energy. H painkiller. Narcan in case I do too much H. Benzodiazepines, it's gonna be stressful. Moxifloxacin might get a disease. Better safe than sorry. EpiPen in case I'm allergic to moxifloxacin. I am allergic to penicillin and amoxicillin, so I might need it. Not a professional but penicillin, antibiotic, diphenhydramine, sleeping pills, oxycodone or fentanyl, powerful painkillers, codeine, powerful cough suppressant, amphetamine, stimulant for when you're weak but have to continue, and alprazolam, a benzodiazepine for panic attacks. Things like Tylenol and Advil aren't necessary, they just help with headaches. Things like Tylenol and Advil aren't necessary, they just help with headaches. Sleeping pills aren't necessary either. Also, Tylenol and Advil help reduce fevers, which is pretty useful, I'd say. Son of a medical professional, I'm gonna go down the Barter route as a few had mentioned. Ciproca's THST is randomly placed all over our house, so I assume it's one of the better ones. Adderall. For me to keep focused for more than 17 seconds and will bring me all Thibnal's team to mid-20 customers. My pharmacist friend keeps telling me I need to switch to grown-up drugs, so I'll add ibuprofen. Old people. Then fentanyl, Viagra, Xanax. I'll make it as one curial so people get addicted to boners, but are cool with it. Long-term insulin. No one I know is diabetic but you can barter it. Midol. For the women. Barter it. Amoxicillin. Simple general purpose antibiotic. Colace. Stool softener. Antifungal. Viagra. Long shelf life and will lower blood pressure. As a woman I'd much rather have Xanax in the apocalypse, and a host of life-saving medications, than Tylenol and caffeine. A couple of broad-spectrum antibiotics. Morphine. Tetanus shots. Multivitamins. Prednisone. Just a few things so that minor injuries don't kill you, the major ones are gonna take you out for sure. I'd love to have IV fluids but they'll just expire before you need them and be difficult to cart around. H. C. Marijuana, ketamine, MDMA, and LSD. It's a post-apocalyptic world. Frick all that survival crap. You want to stay alive? For extra hearty pain and suffering and loneliness? You are not building a utopia. Your kids, if you're lucky enough to find a fertile woman, are going to be all kinds of fricked up. Nah, I'ma just have fun till the infections, radiation exposure, loneliness, zombies kill me. Everyone has had suggestions of prolonging their own lives, but I'm thinking you'll need at least one medication for defense in a post-apocalyptic world. Might be cheating. but arsenic trioxide is used as a chemo agent, would be a good deterrent to any adversaries. Why are so many people saying vancomycin? It's given by slow IV infusion. Can't imagine you're gonna have sterile infusion sets and pumps, and difficult to dose. Better off choosing something broad spectrum which can be given oral or IM. Ketamine, oxycodone, paracetamol, acetaminophen, Hartmann's solution, adrenaline epinephrine, ciprofloxacin, meropenem, ketamine for performing surgery, fixing fractures etc., oxycodone for pain relief, and for those who aren't going to make it, paracetamol so that people can keep rebuilding the world despite more minor injuries. Hartmann's, intravenous, for dehydration from the inevitable gastrointestinal disease epidemic, adrenaline for stabilization of severe cases, assuming we have facilities to try to look after them, ciprofloxacin and meropenem antibiotics, though with only those two everything will be resistant in a pretty short while. Above assumes we have some salt and sugar and water for making our own rehydration solutions etc. Actually lived in a world that in many aspects was post-apocalyptic. Plus in a countryside of that, what pulled us through was 1. Kalium permanganate for disinfection, 2. Activated carbon for any kind of food poisoning, 3. Alcohol, disinfection, rubbing, against fear, on burns to stop forming of blisters, that stuff is really universal, 4. Lycopodium powder to close wounds, 5. Paracetamol. Those did ensure that people didn't die because of a little scratch or expired products, but if you had something more serious then sorry, as number 6 is still free I would toss in some painkillers. I would choose good old piptazo, or imipenem cilastatin, levofloxacin, vancomycin, or linezolid, prednisone. I would also try to sneak some aspirin, for people with heart problems and as an NSAID at higher doses. Epinephrine gets a mention. I think overall more people would benefit from the aspirin. We would probably need antifungals and antiparasites, but I think I'll stick to those 6. I'd also like to point out that any med in a post-apocalyptic world where stocks are rare would be worth a lot. No need to stock opiates for the sake of dealing it, especially not fentanyl, since most people probably won't be taking opioids to develop a tolerance. Med student here. Too many people talking about allergies, depression meds, insulin, birth control etc. If the works is post-apocalyptic we need to keep the masses alive, not treat the type 1 diabetics or the depressed people. 3 antibiotics, piptaz, gentamicin and metronidazole, cover the most common infections that can knock out a well-functioning adult. I'm surprised at not seeing metronidazole on enough lists. Parasitic infections will run galore in a post-apocalyptic world. Ketamine, very versatile. General anesthesia, mild anesthesia for when we reduce fractured bones. Use it as the analgesia of choice. Ibuprofen and paracetamol aren't gonna make the list. Tough it up. It's a post-apocalyptic world. Hartmann's solution. Need to rehydrate. Better than normal saline as it's closer to physiological status. Oxygen. It's technically a drug in some jurisdictions. Self-explanatory, everyone that's gonna need an operation will need it. Anyone that's critically unwell will need it. A benzo such as lorazepam. It's versatile. Diphenhydramine. Treat anything that needs an antihistamine. That's 8. If I need to take off 2 I'd make an argument that Hartmann's solution and oxygen aren't meds. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.